Welcome back to Another Thing. I'm Larry Menti. Telemedicine, if you haven't heard about it yet, if you haven't used it yet, chances are you will, and very soon. To talk more about what it is and why you might be using it, John Ulett, who is the CIO of Central State Medical Center, and Dr. Deepa Rajiv, who is the medical director at Northern State Prison. Let's, first of all, because I just said Northern State Prison, people are going to go, wait a second, why is she there? And so why don't you explain what telemedicine has to do with the prison system?
Well, telemedicine actually was already in place, being used by DOC. Video conferencing, I should say. Video conferencing was already in place by DOC, using this equipment to allow for judges to meet with the inmates and for parole hearing. What we did, what Rutgers UBHC did, was just capitalize on this instrument and spend some money, invested some money to upgrade it from a telephone-based system to an internet system, and it allowed us to it allowed the patients to see the consultants, and by doing this, we managed to save quite a bit on transportation costs.
And so it's a doctor, you know, I should back up a little bit. It's a doctor on one side and the patient or a prisoner slash patient on the other side, and they're meeting that way. And so they don't, and so it alleviates costs, so they don't have to come in there and then have to pay for a doctor visit, and there's less cost. You know, I keep hearing that this is the wave of the future and that it's happening so much now. I've never done it. I don't know anybody that's done it yet. So how can it be the wave of the future if everybody I talk to hasn't done it yet? I mean, where is this happening? So
it's actually happening in several layers at several places. You've got the kind of visit the doctor was talking about, where it's patient and face-to-face. Telemedicine we use in two areas. In our radiology, we send radiology slides off-site at night, and they get read in a foreign place. That's telemedicine. We have an agreement with Hackensack, and we have pathologists, and they can operate slides. If you need a second opinion or increase the scope of the care team, we do it there. And we also have devices we're sending home with patients to hook up to an iPad and send in their weight and blood pressure, so that the care navigators can actually see how they're coming along after they've been discharged with congestive heart failure. So you can do it where it's face-to-face, or you can do it where you're hooking computers and diagnostic equipment up. So you may have already used telemedicine and not know it. Yes. And so when people say it's happening a lot more, it can be during a surgery. It can be during some operation where somebody is watching in, and you may not even know they're there until, of course, you get the bill. Is that right? Absolutely. And there is a huge increase in doctor-patient visits. When you don't need to do hands-on, you can actually connect up. There's several sites you could call today and schedule an appointment with a doctor, give them your credit card, and a 15-minute slot's given to you, and you can meet with the doctor over Skype or an iPhone or secure line. Now, that's not the type of telemedicine that's happening at the prisons, though, is it? No, that's we have the cameras, the computer monitor, the cameras. It's in a secured DOC building. The consultants are actually brought into an office, head office in Trenton, once again another DOC secure building, where they are scheduled to see the various patients. Sitting in that office, that consultant can see a number of patients from all the different sites. Oh, that's interesting. So it's like a waiting room to get to a computer screen? Yes, there's an office, a telemed, that's just for telemedicine. They have the computer there where the consultant is brought in, and from there they log into the different sites and complete their seeing their patients at the different sites. So they can finish this many number of patients from this many sites on that one, in that few hours. I understand how it makes some sense by doing that. You know, Larry, we have an ED, pediatric ED, and we are connected to St. Peter's with TV screens. So if you need to have a pediatrician intensivist, and you've got somebody in your ED, we can actually increase the size of the care team and hook them up. And while we've got ED docs working on the children, you can actually get second opinions and additional insight from intensivists who are located in New Brunswick.
It's all fascinating, and we're running out of time, but you can see so many uses for this. Military uses, that you can have specialists talking in the field to doctors, with these Doctors Without Borders, rather than going, they can just do it by telemedicine. So it's wonderful to learn more about it. Thank you so much.
Thank you.
Doctor, thank you
for
coming in, John.
Thank you, Larry.
Thank you very much. John Ulett, CIO of Central State Medical Center, and Dr. Deepa Rajiv, Medical Director of Northern State Prison, Rutgers. I didn't say that the first time. At Rutgers. When we come back.
Urban Trinity. The story of Catholic Philadelphia captures 350 years of history.